everyone. Welcome to our Rhode Island Veteran Oral Health Virtual Road Tour. We're thrilled to be here with you today. Hi, Julie. As you folks come in from the waiting room, I invite you to come on camera. This is a bit of a didactic presentation, but it's designed to be as interactive as possible. So great. I love to see folks, and I hope you're ready for some great conversation today. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. We're very excited to be talking about veteran oral health in Rhode Island. I am particularly excited. I am a very proud New Englander. I grew up just a couple miles away from the border of Cumberland. So I feel a little bit, although I'm from Massachusetts, like I'm talking to my home state here. Christine Coffey, our Director of Communications, is sitting in for a bit with us today, and she's also in Massachusetts. So I feel like we have a great New England contingent here, although we're a national organization. Rahel Michael is our other colleague on the call today. She is also available for any questions or troubleshooting. You can message her in the chat if you have anything come up. So let's go ahead and get started. We are going to start with a national overview of what veteran oral health looks like before we dive in more specifically with the data in Rhode Island. As I mentioned, we want this session to be as interactive as possible. We want to hear from you. So if you have questions, we'll have time for Q&A, we'll have time for discussion throughout, but if something occurs to you, please pop that in the chat. And we are going to leave with action items and next steps. Some housekeeping pieces. We are recording this session. We ask that you stay muted until it's time for discussion. The slides, the resources, the materials that we share here today will be available on our Academy. We'll talk a little bit more about that at the end to make sure everyone can access the materials afterwards. We also want this to be a time and a space to provide connection for you with your colleagues in your state who are working in oral health, who are working on veteran health. So please take a moment and introduce yourself in the chat. Share your name, your organization. If you want to share your email, we find that it's really folks are able to make a lot of connections about the projects and programs they're working on and share that out with their colleagues on the call. So please feel free to make those connections. Again, if you have questions about Zoom or having a troubleshooting issue, please message Rahel. She can help you out. Okay, I mentioned that we are going to engage a fair amount throughout this session, and one of the ways that we're going to do that is through Slido.com. If you have not used Slido before, it's fairly intuitive. You can access it one of two ways. You can grab your phone and scan this QR code here, or you can simply go to Slido.com and enter in this reference number that is here. Rahel is also going to put the website and this code in the chat, and you'll be able to see it when we pull up polls and questionnaires throughout the session. Okay. These are our learning objectives that are tied to our CEUs. Again, we'll give more instruction at the end of the session on how to request your CEU for this session. That's free. They encompass what we're learning today. They're also available in the registration materials as well as on the Academy for today's session. Okay, we're going to get warmed up with Slido. So if you still have it open, go ahead on over there, or you can go to Slido.com. Again, it's in the chat if you didn't open it before. And we want to start this session by hearing about what brought you here today. Was it learning, wanting to share, wanting to connect, or wanting to act? And perhaps it was all four of those. So that poll is now live. It should be popping up if you scan that QR code or entered in the reference code here. I'll give a second for folks to answer. Okay, learn, I love that. You'll have to check in with me at the end and let me know if you learned anything today. All of the above, so same piece, all of the above, that includes the learning piece, 75% at all of the above. I also am excited that that means that we're going to hear from you they're going to be able to share about the programs you're working on. You'll be excited about the action items we have at the end, and you're going to connect with your colleagues in the chat, okay, or via conversation. All right. Thank you for getting warmed up with that. If you haven't yet responded, please do so, even though we're toggling back over to our slides. I am your presenter for our session here today, and I do not have any disclosures of conflicts of interest to share. I introduce myself as the Director of Education and Leadership here at AIDPH. I will also share, as well as being a public health professional, I'm the spouse of an active duty service member, and so being able to work in veteran oral health is very exciting for me, both personally and professionally. It's a topic area that is near and dear to my heart. I mentioned I am joined by my colleague Rahel, and we want to give a big thank you to Julie Gaushaw, who made this session happen here today. Thank you so much, Julie, for working with us, for sharing out. There were great registration numbers. We wouldn't have been able to reach all of you and share that we had this program going without Julie's assistance and support. So thank you, Julie.
A shout out to all like the Department of Health, also helped to get the information out. So I think we have a great audience because they were also able to put out some advertisements and information out for registration. So
that's wonderful. Thank you. I love the strength of the coalition. That's fantastic. Okay. So back to Slido again, as we're getting started, we want to know, what do you believe the top priority areas are for veteran oral health in your state? And this really will help me tailor the session as we go through today. So some options are oral health literacy, workforce development, policy advocacy, access to care. Great. Some of you may or may not know that our goal is to deliver this seminar to every state in the country. We are doing the seminar because we have state profiles on what veteran oral health looks like in every single state. Our goal is to chat with stakeholders with this session. And we've been to well over 50% at this point, and without fail, access to care is always the number one piece selected here. Okay. Integration with general healthcare, we're definitely going to talk about that. Workforce development, I would love to hear if folks are working on that or what their specific areas are. Workforce development is incredibly important. Okay. We're going to go back to our slides and go ahead and get started. We're going to talk really quickly about who we are at AIDPH and why we're here doing this seminar. We're a 501c3 nonprofit organization, and our mission is to empower our community to advance oral health through science, education, and advocacy. Our community being you, dental public health workforce, the public health workforce, and you will see science, education, and advocacy coming together in the way that we work with that across our organization, coming together in this session here today. We do this work because we have a vision of a justice-oriented oral health system. We have 4 communities of focus at AIDPH, which includes LGBTQIA+ folks, veterans, which we're talking about today, people with disabilities, and rural communities. Understanding, of course, that there is intersectionality on these 4 communities of focus. For example, what we're talking about here today, approximately 30% of veterans report having a disability, and approximately 25% of veterans live in a rural area, something that we're going to dive into quite a bit more as we talk about the data and looking at the disparities that face veterans accessing oral health care. All of our communities of focus have the common experience of historical exclusion and marginalization from healthcare systems. We want to take a moment and say thank you to CareQuest Institute for Oral Health, who is our funder for this program. And highlighting a little bit of the work that we have done with CareQuest, we have quite the compendium of work and research in veteran oral health at this point. We're going to talk about that throughout the session. That is where the data came from, is this work that we've done mostly in partnership with CareQuest. Starting in 2021 with a community engaged survey, working with veteran organizations themselves. Something about AIDPH is that we always strive to conduct our work in a community engaged manner. And throughout our time and conducting this research and doing this work, we've also had the opportunity and a privilege of going to several Hill Days, um, giving briefings, and working with folks to advocate for veteran oral health along the way with data-informed policy recommendations based on our research. Okay. So let's dive into it and start with what does veteran oral health look like at the national level. So this might be familiar to some of you, but doing this work for many years now, we find that it's often surprising to folks, and folks aren't fully aware of how VA medical and dental benefits actually work. So that's why we like to start by kind of setting what things are at the national level and clear picture of what's currently available, and what veteran oral health looks like at the national level. So over the next two slides, I'm going to make two key points. The first one being is that eligibility for medical and dental through the VA isn't set by the VA itself. It's determined by Congress through a federal law called Title 38. And that law outlines what care is covered, who qualifies, how much it costs, and where it can be delivered. And because of that, any major change like expanding dental coverage requires congressional action. So I'm kind of chuckling there. As you can imagine, when we're talking about systems change and advocacy, that's really a long game, right? We understand that making a change at the federal level like that takes a lot of time and a lot of tenacity. So the piece is, it's not a policy or a rule change. It really involves passing new legislation at that federal level and then securing federal funding to support that legislation if we want to expand dental access through the VA. So when we talk about the limitations in access to dental care for veterans through the VA, it all ties back to that federal level. But the point that sounds a bit maybe hopeless, I want to point out that that doesn't mean we can't take action to impact change at the local and state level. The first step to that is getting educated and understanding the population needs for veteran oral health, and then collaborating with our local communities. We're going to share some examples from some state-based legislative actions that have increased access to care for veterans in those states later on in the presentation. So the second piece that we're going to talk about is that currently, most veterans are not eligible for dental care through the VA. So determining eligibility happens at the federal level, and most veterans are not eligible for dental care. So this graphic here, that top row of people you see represents all 18 million veterans living in the US today. The lighter colored half shows the veterans who either receive care outside of the VA or aren't eligible for VA healthcare at all. And as you move to the left of that chart, the darker blue section there represents the nearly 9 million veterans enrolled in the VA healthcare. But of those, only a tiny fraction, that small darker blue and red segment that you see, is actually eligible for dental care through the VA. So what that means in practice is that veterans might go to the VA for medical appointments, get treatment for chronic disease, but they might be having oral health complications that aren't getting treated. And it might be impacting those chronic diseases as well. We're going to talk about that in a minute. So another piece here is that of those about 1.8 million veterans who are eligible for dental benefits, only about a third of them are using those dental benefits. We need more information to fully understand in a data-informed way why that is, but we suspect that barriers to care and lack of awareness play a big role in that low utilization rate. So we're going to talk about that a little bit more. We mentioned rural veterans, right? Understanding they might be eligible, but can they get to a clinic? Can they get that care? So that's something to keep in mind as we kind of dive into the more local data that we're going to look at. So going back to that chronic disease piece, veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues. This is probably familiar to many of you, the connection between chronic disease and oral health. What is even more concerning is that veterans with those high risk, high cost conditions are more likely to lose all of their permanent teeth, and we see poorer oral health outcomes for veterans than non-veterans, even if they have seen a dentist in the past year. So that tells us that access alone isn't solving that problem. Even when veterans are getting dental care, many are still facing some of the worst oral health outcomes. A big reason of that is the lack of integrated care. So those chronic conditions aren't being addressed in coordination with oral health needs. And we know that the VA is the largest integrated healthcare system in the country. We believe that it's uniquely positioned to manage complex care for veterans with multiple chronic conditions. But since most veterans aren't eligible for dental care through the VA, they're missing out on that critical care coordination piece, which leaves major gaps in their overall health outcomes. Okay, we're going to dive into this a little more specifically. This comes from, again, research that we've done with in partnership with CareQuest. We'll go ahead and pop it in the chat now if it's okay, Rahel. Our website, vetdentaldata.org, holds all of our research. We're going to reference that throughout this session, so we'll go ahead and pop that in there early in case folks want to see the publications that this information is coming from. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes were still 40% more likely to be edentulous, meaning they've lost all of their natural teeth, compared to veterans without diabetes. So that's a really powerful indicator of how strongly chronic disease can impact oral health outcomes, even when other risk factors are taken into account. Just as concerning are the findings related to heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. Okay, so let's look at this at a systems level. And what we're highlighting here is that this isn't just about poor oral health outcomes or reduced quality of life. Of course, those are very serious concerns. It's also about the broader health impact and the cost of care. So our research shows that when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental coverage was expanded, there's a clear opportunity for cost savings, especially for veterans with those chronic conditions that we just spoke about. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's a $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care, it can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's paying for itself. So keep this context in mind as we look at chronic disease trends in Rhode Island and consider what solutions might look like there. Again, these are some points looking at rural veterans. These data points were collected coming from Burfus as well as data accessed through the VA and looking at that urban versus rural veteran piece. Also sharing out here, it's important for us to approach our research in a mixed methods manner, to really pull in the first person account and the storytelling side to look at the personal impact of what the data is showing us. This quote I'm sharing here is from a working age veteran in Maryland. And I think it's really striking of just understanding the impact of those poor oral health outcomes that we're talking about. This person is unable to get the assistance and care that they need, and they're asking for help. Okay. These are some screenshots over the next few slides that come from that website that Rahel popped in the chat, which is vetdentaldata.org. Our research all lives there. And in addition to the state profile that we're going to talk about today, we have a few different options for interactive data dashboards. So you can really go in and click through and look at the data you need for your program, your project, your department, to dive in and look at what's going on in your state in a more detailed manner. We have an entire tab dedicated to rural veterans. And I want to point out here with this is that while the data aren't available from MEPS, which is the Medical Expenditure Panel Survey, on a state level, they can be evaluated by region, so you can get a sort of proxy for state level data with this dashboard. Looking at this piece, showing when you click on the rural tab, it takes you to the interactive dashboard on rural veterans. And across each indicator, it's clear to see that rural veterans delay dental care due to cost, spend more out of pocket on dental care, and struggle to find accessible locations for dental care. Okay. Rural veterans also feel more impact from lack of access and utilization of dental care, often citing that the state of their mouth or teeth is embarrassing compared to non rural veterans, kind of going back to that quote that we shared earlier. Rural veterans also struggle more with a functional dentition, which likely leads to the data points we see around increased cost of care and higher emergency department use. Okay, this is highlighting some of those publications that I have referenced as we're talking about all of these data and what is available on vetdentaldata.org. Okay. So, to kick things off, I want to share a little bit about Rhode Island and give you some background on why we're doing this. I've talked a lot about national level data. We are a very small nonprofit working at the national level and have had the privilege of working in veteran oral health for quite a bit of time now. As we did this work, we were repeatedly asked, what does it look like? What does veteran oral health look like in my state? And that is how we were called to develop out these state profiles that we're going to talk about in just a moment here. Um, our research team obviously did the research and then worked very closely with our communications team to develop out these profiles in a very easy to understand, visually appealing way so that they weren't just research for folks, that they were a usable tool that people could use and automatically take without doing any work on their end to decision makers to use in their grant either request or reporting. Our goal is always to have translational science and pull our research into very usable tools for all of you. As we get started with the Rhode Island state profile, I invite you to pull that profile up to kind of go along if you haven't already taken a look. Okay. And before we dive into Rhode Island, I would love if you could go back to Slido and share in one word, naming what you think your state's biggest challenge is for veteran oral health. We'll toggle over here. I see access getting bigger and bigger, which means more and more folks are plugging that in. Same with affordability, affordable dental care, expensive. So all of these pieces are incredibly similar and incredibly interconnected. Okay. We're going to toggle back to our slides, but if you have something to input and haven't had a chance to do so, please continue to do so even as we go back to our slides. Okay, so let's get started with your profile. And I want to note here that I said at the beginning, we want to hear from you. This road tour, virtual road tour that we're doing is just as much about listening and learning from you. You know Rhode Island best, your data, your context, your communities, and your insights really help us improve these profiles and make sure the tools that we're providing are actually useful in your efforts to support veteran oral health. So we have some questions throughout to hear from you, but please share out what you're seeing and what resonates, or if there are different pieces you're seeing in your state. Okay. Okay. So we've opened each profile with the context of what's happening in Rhode Island and how it fits into the bigger picture nationally, especially when it comes to dental care access through the VA. So again, just like we started this seminar off, the key point is always most veterans are not eligible for dental care through the VA. I feel like a broken record doing the seminars as much as I do, but we really find that that is very surprising to folks, even across the board, even to oral health clinicians, even to folks that we partner with on this work. A lot of people assume that if folks are eligible for care through the VA, that includes dental care. So that can be a really powerful place to start the conversation if you are approaching policymakers, funders, decision makers, on making sure that they realize that this care is not provided through the VA. Okay. So we've also included data on where veterans live across Rhode Island, um, really understanding kind of that location and looking at those counties and understanding that piece can tell you maybe where you need to start or maybe the places that have the highest need. So we hope that this gives you useful county level insight to support better informed local decisions about how to deliver care and improve access. Okay. So we have them highlighted here and then see that this kind of pulls us throughout um, the state. Okay. So here on this part, we compare Rhode Island to national averages because without that context, the numbers don't mean much if we don't understand how they compare nationally. So again, if you're sharing this with a policymaker, a decision maker, they might not know if 10% is high, low, somewhere in between. So we've pulled in that national information to give a good context. The other piece I will say here is that some states have similar challenges or demographics, particularly with New England being so small. Something that can be really helpful is this gives you the national piece, but you can pull up other states that you might have colleagues in or know has similar demographics and compare their numbers to your numbers. Okay. All right. So again, you're looking at data on heart disease, diabetes, insurance status. Okay. And then we come over to our grade portion. Again, looking at the idea of really taking the data and making sure it was as usable as possible. We chose a report card format because the majority of folks have received a report card in their lives, and it's a really quick, easy visual to understand where pieces are standing. So we see the grades given individually for diabetes, rates of uninsured, and dental visits, the percentage of veterans in Rhode Island that visited the dentist in the past year, and then those three pieces combine for the overall grade. And what I want to point out with this portion is to encourage you to not only look at the areas where there is a low grade, so looking at that diabetes piece here, that's an obvious call for an improvement, but really taking a look at where you're succeeding. That uninsured rate is really impressive. So understanding kind of those sections where there is success and what got you there. Were there specific strategies? Why is that number so high? And are there lessons there that can be applied to the other pieces that need improvement? Okay. You can also use that tactic if you're comparing your state to other states and looking at their numbers. This is also a screenshot from vetdentaldata.org. You can pull up specific state profiles, but if you go to this map, I'm just highlighting that you can hover over and have a quick snapshot of what data is in each state. So you can kind of get a sense of what profiles you might want to pull up and look at in more depth. Okay. So I have been chatting for quite a while, and I would love to hear from you. Again, understanding that data is limited, right? We're pulling publicly available data sets and doing an analysis. What is a barrier that isn't in that data that we just looked at, but you know is real for veterans in your community based on what you're seeing in your work? I'm seeing Sam say mental health. If they have Medicaid, finding a participating provider. Okay. So I'm wondering if that's the Medicaid piece is tying into that workforce piece. So maybe it's not even necessarily a low workforce, but workforce that's accepting Medicaid. I see a lot of head nodding happening. Mental health, absolutely. Um, we know that mental health can affect getting oral health care, and we know that oral health outcome can affect mental health. There's a huge connection there. Also, particular to these calls, it's something that comes up on these community conversations over and over again is trauma informed care. And how can we expand trauma informed care, particularly when it comes to veteran populations? Fear of getting dental care, past traumas, etc. Absolutely. Anecdotally, we see that reflected as well of folks. Sometimes they might have access to care through the VA, but there can sometimes be trauma and fear associated with going to the VA because of past experiences. Okay. All right. This is great. Thank you guys for participating. I'm going to keep going with the slides. Oh, wait a minute. Transportation. Feeling welcome in a practice and comfortable to ask for help with oral health issues. Yeah, that's really great. Um, I'm just thinking of the practice piece. We're going to talk in a minute here about how to use this profile and how to have conversations, and that feeling comfortable in the practice piece is one of those things I think can really happen at the local level. When we talk about advocacy, folks often think of um, legislative advocacy, going and talking to legislators. But I think something that can happen with a session like this, when the coalition's coming together and having a shared awareness of the population need, it can be things like maybe you're having an in-service with your practice, or maybe an in-service that multiple practices could come to virtually. So we could increase that comfortability. Maybe it's changing intake forms, right? That comes up a lot on these calls. So that's a really good one to raise. And transportation also comes up so much in our work, both with veterans. We have a separate rural seminar that we do bi-monthly. Transportation, as you can imagine, comes up over and over again. Um, and the piece that I find is transportation is always an issue, and but the exact transportation need or challenge is very location and geographic specific. So if y'all would like to chat a little bit more about what the exact transportation issue is in Rhode Island, I would love to hear that piece. Okay, this is really great conversation. Um, I am going to go to our slides, but if you have something that you want to share that you haven't plugged in, please continue to do so. Okay, so we just covered a lot of information, and I hope the details were informative. Those who came here to learn, I hope you feel like you have learned something thus far. What I really want you to take away from this session is next steps and feeling activated. So we're going to talk a little bit more about how we can leverage these profiles and these data as a tool in your work. So using the data to illustrate the need, um, having that shared awareness of the population need, sharing the profile to start conversations. Again, that comfortability in the practices piece really comes to mind, and taking action to elevate success stories. So advocacy, I just kind of mentioned this piece. One of the most powerful things we can do with data is to advocate. And again, that can be going and doing legislative advocacy, but it can be doing something like having an in-service on how we can make veterans comfortable in our practice or in our clinical care. So it's a really broad spectrum. And I would love for you to keep that in mind, thinking through how you can pull this information forward in your community. This profile, we hope, gives you credible local data to bring to, again, other folks in your coalition, a city council meeting, state legislators, your congressional reps. You could go and organizing a listening and learning session, again, kind of an in-service type piece. You could do that in your community. You could invite decision makers. You could invite veterans themselves to make sure that we're raising their voice. And again, small advocacy actions, like something like an in-service or calling someone, really have large ripple outward effects, especially when they're done across many, many people. Okay, looking at education. So I've said this many times now. I hope you're not sick of hearing this, but I can't stress enough that many people working in healthcare or veteran services don't know how stark the oral health gap is. So really having that as a starting point and using that as a jumping off point for education. So we hope that maybe you'll consider using this profile to lead a short talk. Maybe you pull it forward for a 15-minute presentation at a staff meeting or brief another coalition partner. We find that when stakeholders are informed, they become allies and activated on working towards serving that population. And that's how we build momentum and start affecting change. I also think it's an opportunity to collaborate across silos. So at AIDPH and public health in general, we talk a lot about non-traditional partnerships. And this is, I think, an opportunity for that. So maybe you bring this to someone in housing, mental health, that came up, food access. Maybe there's an organization that works on transportation for another piece that we could talk to about what transportation solutions we could find. Really looking at those non-traditional partnerships and finding ways to align your efforts. So informing strategic decisions. So we hope that this, again, kind of having a snapshot of what's happening in Rhode Island, whether you're leading a nonprofit, managing a health program, we hope that it can really give you an idea, excuse me, if your organization or your program is poised to start taking action. Hopefully this is kind of gives you a strategic overview of deciding where to focus. And the where might be an actual where. So it might be those counties that have a higher population, but it might also be an issue area like diabetes, right? And we also hope it helps you make a case for why you're investing resources where you are. And if you're doing evaluation or reporting, giving you a baseline of here's where we're starting from and here's where we're trying to go. So to that end, talking a little bit about how this profile can bring in resources. So grant makers and funders, we know, want to see data. They want to see it grounded in the community. So we're hoping this profile gives you a base for that. You can use it in your problem statement for a grant request. You can use it, again, citing it as a foundation. So if you're measuring in a program, really giving you a benchmark of measuring your outcomes and deliverables of the program that you're doing. Okay. So again, going back to Slido here for a second, we want to be leveraging tools and research to best serve the work that you're doing. So we would love to hear from you about what additional tools would be most helpful in your work. We have here education materials, policy brief, research findings, training modules. If there's something you want that you don't see here, feel free to put it in the chat or shout out policy briefs. Okay. Education materials. I have a follow-up question on education materials that comes up a lot in these calls. I would love to hear from you. Do you have a specific audience for education materials? Sometimes it's care coordinators. Sometimes it's veterans themselves and helping understand the resources that are available. Sometimes it's clinicians and talking about how they might need to understand that if they're serving veterans. If folks have thoughts on that, I would love to hear them. Okay. Go ahead and keep responding as we go back to the slides if you haven't already. And we're going to talk now. I mentioned at the top of the call that we would look at some ways that states have been able to pass state level legislation that increases access to care for veterans without needing those federal changes, right? So these are 3 success stories that we like to highlight as kind of a launching pad, as well as highlighting some states to take and keep an eye out on. So Florida passed legislation. This is fairly new. I'm not sure if it was passed at the end of last year or early this year. It was just implemented this spring, creating a Veterans Dental Care Grant Program within the Florida Department of Veterans Affairs. And the program was designed to provide dental care to veterans living in Florida. The department partners with a statewide direct support organization to administer the program, and then that organization distributes grants to nonprofits with a strong track record of serving veterans. And those nonprofits deliver care to eligible veterans based on income, service history, and other qualifying data. So again, it just was started this spring. I believe that they've just gotten approval to keep the program going. So this is we thought that this was very innovative and exciting piece to keep an eye out on, and keep an eye on Florida to see how that's going. Oregon developed an innovative Medicaid carve out specifically for veterans who don't qualify for VA dental benefits or traditional Medicaid. So veterans are first screened to determine if they qualify for either, and if not, they're enrolled in a local coordinated care organization and receive free dental care through a network of community clinics participating in the program. In Iowa, I'm going to talk a little bit more about Iowa in just a minute, because we've had the privilege of working very in depth and doing a more in-depth report in Iowa. But highlighting that the state uses lottery dollars to fund the Veterans Trust Fund, and that fund provides direct grants to veterans to help cover out-of-pocket health expenses, including dental care. Okay, so looking at veteran oral health in Iowa, this is really just sharing a little bit about what can happen in a state, going more in depth. So our research team did a year-long analysis and published a 70 some odd page report on veteran oral health in the state of Iowa, not just looking at that data, but putting forward strategic recommendations of paths forward to advance oral health. After we did that work and published that report, we were able to go out and have a series of stakeholder engaging forums, both virtually and in person. We culminated in an in-person veteran oral health summit where we really looked at those strategic recommendations, spoke with stakeholders, facilitated collaboration on those, and really got to a point of what was actually feasible in the state of Iowa based on the infrastructure and the stakeholders that they had at the time. We published out summary reports, and we just recently published a full strategic report for Iowa, and we're about to publish an advocacy toolkit for Iowa of how they can pursue things like one of the recommendations is expanding that trust fund that I just spoke about, that really provides a very clear path forward for stakeholders in Iowa to follow strategic recommendations and take action on advocacy and move forward with implementing the strategies that came out of this report. Okay. I'm going to pause and pull down my screen for a second. Are there any questions I can answer for folks? Go ahead.
I was gonna say, I have to say, it's been really good to see how the data that you've been able to present could help us in our state to do some of those initiatives and then sharing those initiatives that are already out there. Um, I think it'll bring on other conversations outside of this forum.
So I think it'd be helpful too to understand where are vets getting their care. When we look at health center data, we can see, that is captured. I guess if they share that information, it's captured. So we can see some numbers, but we don't necessarily always have the breakdown as by service. So I think it would be interesting, to see if we could have a better understanding how health centers are supporting, maybe if there's some gaps in care or other efforts could be made in that space.
That's a really great point, and I love when that comes up as a community conversation piece, we would love to have more insight into, it's a question that we get asked often of where are vets getting their care. And our answer is we don't have access to the data on that, and or it's not being collected comprehensively. So we love to put forward that that's a recommendation we have for local communities to have that conversation of, are there improvements to the surveillance systems we have? Are there ways we can access that data or be gathering that data so we can start there and then move forward with that? We love to put out data gathering recommendations at the local level. So thank you for bringing up that point.
Yeah, and we can see the changes in the trends, in our health centers as well, to say, oh, you might have had 55 and then 150 in the next year.
Mm-hmm.
So, some of our health centers might be looking at programs that are more specific to supporting vets as well. And just kind of would be an interesting kind of quality improvement just to check in.
Yeah, definitely.
And it's interesting, one of the areas that has the largest number of vets, or largest proportion wise, was Newport County, probably because, former naval base there. And unfortunately, that is probably one of the counties that probably has some of the fewest dentists, or, and I think that the health center there, they do a great job, but it's one of the smaller health centers as well.
Yeah. And they don't seem to have a high number of vets. And again, that information is only if it's shared. So if a person chooses not to share, that information wouldn't be captured.
Yeah.
Unless they're using their, TRICARE or maybe another, their actual insurance or that type of thing.
Are there other questions folks have?
Did you know the breakdown of insurance types, or is it Burfus data that you're using? What kind of data are you using?
Yeah, so Burfus is one of the main pieces. There are some areas where we were able to get information from the VA. That was, I believe, a legislator submitted a request for information for that data for us to use. So again, publicly available data sets, which we know are limited, particularly when it comes to oral health. And then again, approaching it in a mixed methods manner, we pull in those qualitative pieces, which is independent research that we conduct.
Because some years our Burfus has asked, what type of insurance do you have? So
Okay.
could possibly help. We can't include that for every year, but for some years we've had it.
Yeah. Yeah, but that's great to understand kind of as a coalition and as a state, if and how that's being asked and when.
I guess the other question I hear of, like, I've gone to National Oral Health Conference or other meetings, and you hear of cities or counties that you have a wonderful dentist or dental team that's put together like a free clinic for veterans. And I wonder how successful those are, how sustainable those are. I don't know. That's again, I think it's wonderful, the people who dedicate and pull together a whole team of people to do it on a regular basis. We have here like a Mission of Mercy program, which is a couple days, but to be able to do something with regularity and have dental teams volunteer and do that, I just what's your observation on the national level of programs like that?
Yeah, I'm going to provide you a public health informed answer versus I don't have data at my fingertips on kind of a success rate overall, or the kind of a percentage number of folks that we're serving through those. That comes up a lot, as you can imagine. There's many amazing organizations across the country that are providing pro bono services, days of care to veterans as well as other populations. And it comes up when we're doing our work in veteran oral health a lot. And the piece I like to put forward for folks who hear as public health professionals, if we're talking about water safety and we talk about that Swiss cheese kind of approach, and I don't know if that's resonating with anyone, of where we're putting in place many, many steps that some steps aren't perfect, right? None of them are perfect. They all have a hole. But if we layer those Swiss cheese pieces with holes in them, we come to covering as much as we can, right? So when we're talking about water safety, we're talking about a fence, and we're talking about ensuring our kids have swim lessons, and we're talking about then ensuring there's always an adult on site, and we're kind of doing those pieces. So when we're talking about that in the veteran oral health space, I think that we think when we're looking at this data and we're thinking about approaching access across the board, we look at it in a systems level way from a public health perspective. We need to change the system so that there's increased access, right? And we know that that is the long game. So we have these education sessions, we bring awareness, we have advocacy days, we talk to legislators. We're really looking at state systems and how we can change those. But in the meantime, people need care. And so those services, those mission of mercy, those pro bono options are providing care to folks while we also work as public health professionals to change things at the systems level. The other observational piece I will put forward with that is we find that often it's small organizations or there's a bunch of organizations in a state, they're kind of working independently. And so there's kind of these one-off pieces. So we always encourage folks, if you on these calls, if there are pieces going on in your state, to share so we can kind of help amplify the awareness of those that are happening and reach as many people as possible. We are also working to add a section on vetdentaldata.org, which is probably like a year-long project. I don't know, Christine, you have any input, but our goal is to add a finding resources in your area section to that website, because we do field those questions from veterans themselves because we work in this space. So providing kind of a directory of sorts to those local pieces. So it's not a very, that's kind of a philosophical answer to that question, but I hope that that provides some insight of how we can approach it. I see a hand raised.
I do want to point out that our vet's home is in Bristol, which would be the county where you're seeing a high number of individuals. So they might be receiving some portable care at, through one of our companies that does that here in Rhode Island. So it'd be interesting to see those numbers, right? So we could kind of say, oh, how many are in the vet's home and they're receiving this dental care versus how many are living outside of there, just to have a better understanding. So
yeah, and that's really what we're that's hoping what we spark for you, of kind of taking that local knowledge with that location-based information and kind of being able to look deeper at what's going on locally, and putting those pieces together. So thank you. That's fantastic.
I think my name is Beth. I'm from Blackstone Valley Community Healthcare. And Dr. Moore, who was our dental director, we've actually had this conversation about it because we do accept Medicaid. We do have sliding fee available for dental care. And I think we've just not known where to connect or put us as a resource out there to veterans. Or
do you need the pain point is amplifying your service or awareness about your services, I'm hearing. Okay. If you're
patients. So
I'm sorry, you cut out for a second, Beth.
I said we are here, we're accepting new patients, so
getting the word out. Okay. If you want to share information, again, we post the Academy for folks to kind of come back and look, if colleagues in our list of information from this session, if you want to share that or email it in the chat or email out to us, we would love to put that forward to colleagues who are looking at the information. Julie?
Well, that's what I was just gonna say. We have a lot of information of people like Beth, Melissa James from the Providence VA Medical Center is on the call as well. So even just for you two to even be able to connect so that the services or referrals could be from their end as well. They know that you're available. So we've got some great people on the call right now that we're making these connections, I think, already.
Fantastic. Okay. I'm going to go ahead and bring the slides back up so we can kind of talk about our next steps here. All right. All right. So folks said that when they came forward at the beginning, they wanted to learn. I hope you all are feeling like you learned something. People selected all 4, so I take that you are, I hope you're feeling activated and ready to take action. And some people specifically selected that they wanted to act. So it's a lot of information. I know that everyone is busy. You all have very important, busy jobs. So I'm going to leave you with one concrete, very easy step to take as your first step in staying activated and keeping momentum after this session. And that is sharing the state profile with one new person or organization. If you are willing, I would love it if you put that in the chat so that we can keep each other engaged and accountable to that action that you're going to take after this session. Okay, these are some logistic pieces and admin pieces for us finishing up our session here today. CEUs, we're going to put that link in the chat. Those are hosted on our academy. That will pull up our full VRT program, so you will see information for every state that we have visited. You can scroll down until you find Rhode Island, and there will be a link where you can complete your evaluation and CEU request form, and it will auto-populate your CEU PDF there. I mentioned our recordings and our resources from today's session will be available on the AIDPH Academy. If you have colleagues or peers that you think are interested in this seminar but weren't able to attend live, or maybe registered and weren't able to attend live, they will be able to watch asynchronously. And if they need a little bit of a carrot, they can actually get their CEU watching it asynchronously as well. As part of our ongoing work, advocacy work, and research in veteran oral health, we are working to gather stories from veterans themselves on their oral health experiences as veterans. We're going to pop a link in the chat here that is our storytelling form. If you yourself are a veteran or you know a veteran and are willing to share this form with them or are willing to share your story, we would be so appreciative. They are anonymous forms. And this allows us to really raise veteran voices when we are doing our advocacy work and having community conversations, having conversations with legislators about that first person impact. Connecting that first person story with the data really drives home the impact, as well as we firmly believe that it's incredibly important for us to lead from behind and be raising veterans' voices first. And this is a way for us to do that. So if you are willing to share out that form or complete that form yourself, we would be so appreciative. Double tapping on the fact that you can find links to today's resources on vetdentaldata.org. And I'm leaving you with the idea that veterans deserve equitable oral health. So a big thank you for being a part of that, for participating today, for engaging in a robust conversation. I thank you for your time and your willingness to be activated for this population. And I hope everyone has a wonderful rest of the day.
Thank you, you too.
Thank you.
Take care, everyone.